Hello everyone, my name is Patience Nduli. Today I'm going to be presenting to you about breast cancer awareness campaign. In South Africa, usually in October, we are celebrating or we are observing a breast cancer month. So I'm going to be sharing with you about breast cancer, signs and symptoms, what is breast cancer, and how we can be able to prevent breast cancer. So I'm going to talk about the organization. As like I mentioned that in South Africa we celebrate breast cancer awareness month in October, and this organization is created to bring awareness to all women all over the world, and this is a government organization. So it is not a private organization, but it is funded and sponsored by the government. So moving on, we're going to be talking about breast cancer. I'm sure most people are familiar with breast cancer. Breast cancer cells, they usually develop when there is a resistance, and usually this resistance, it switches from estrogen signaling to alternative methods of proliferation, allowing them to resist destruction by targeting therapy. These breast cells, they develop in the breast, and now we're going to be talking about the types of tumor. We've got two types of tumor, and those types of tumor, it's benign tumor and malignant tumors. The benign tumor, they stay in their primary location without invading other sites of the body. These are non-cancerous. And the malignant tumors, they are cancerous and can spread cancer cells throughout one's body through blood or lymphatic system. So with benign tumors, they stay in their primary location without invading other sites of the body. And these tumors, they are non-cancerous, like I mentioned, meaning they are not dangerous, they are not bad, they don't do anything bad to the body. But with malignant cancer tumors, they are cancerous, meaning they are dangerous, and they are very aggressive, and they can spread throughout the body, including in the blood as well as in the lymphatic system. And sometimes it even leads to a process of metastasis. And these tumors, the malignant ones, they begin in bones, and those bones, they are called primary bone cancer. And like I mentioned, they are very dangerous, they are aggressive, and they are not good at all. And now we're going to be talking about the statistics. According to the statistics in South Africa, women between the ages of 30 to 49 are the ones who are mostly at risk. As you can see the graph, it shows that women between the ages of 30 going up to 49, it's the ones that are more at risk. They are the ones that should be really concerned when they reach that age, to make sure that they start doing self-check, and they also start familiarizing themselves with doing mammograms and things like that. And the worldwide cases in 2020, an estimated 684.996 women across the world, they died from breast cancer. And breast cancer is the most common cause of death from cancer in women in the United States. So in the United States, it is the most common death, that is breast cancer. However, number of women who have died has decreased by 43% since 2020. That is good news, because now we can see that people are being more educated and more aware of this cancer. Hence, the number of people that are dying has decreased. Now I'm going to be talking about prevention. how we can prevent this cancer. We all we all know that prevention is better than cure, and we have to know how to prevent breast cancer. We're gonna talking about preventive ways. One of them is keeping a healthy weight. We need to make sure that we keep a healthy weight. We eat well. We keep our diet in good shape. Another thing is we have to be physically active. We have to avoid spending more time sitting down, and we need to choose not to drink alcohol. And if it happens that we drink alcohol, we have to drink alcohol moderately. And then we have to talk to our doctors about hormone replacement, especially for those women who have been on birth control or contraceptive pills for some time. They need to find out from their doctors if it is safe for them to continue taking those hormone pills or not, or those contraceptive pills or not. And the last thing is we need to learn about our family history. Learning about our family history is very important because by then we will know if we are in danger of getting breast cancer or not. And then now we're going to be talking about signs and symptoms of breast cancer. It is very important for us to know how to differentiate a normal breast to an abnormal breast. Now, the signs and symptoms of breast cancer. We're going to be talking about the common signs as well as other signs. The common signs, usually there will be a lump in the breast or underarm. There will be a thickening or swelling of part of the breast, irritation or dimpling of the breast, redness or flaky skin in the nipple area or the breast. And then the other signs can be like oozing of pus or blood in the nipple area, swelling of the breast, pulling in of the nipple, or pain in the nipple area. These are some of the signs and symptoms that we can always look out for. And then the next step is doing screening. We need to make sure that when we do have these signs and symptoms, or we recognize these signs and symptoms, we immediately go for screening. And there are different types of screening, and these screenings that I'm going to talk about, the screenings that we have to familiarize ourselves with. For women ages 40 to 45, we should have the choice to start annual breast cancer screening with mammogram if they wish to do so. And then women ages 45 to 54, we should get mammogram every year. With women 55 and older, you should switch to mammogram every 2 years or can continue yearly screening. All women should be familiar with the known benefits, limitations, and potential harms linked to breast cancer screening. And then the types of screening, there are different types of screening. Some of them are mammogram, ultrasound, MRI, CT scan, bone scan, and PET scan. It depends what type of tumor that you are having. Then the doctor is going to decide which screening he's going to perform on you. And then the type of treatment. Once they realize that okay, you've got a tumor and they've done the screening and they found out that it is cancer, then the doctor is going to check and see how far the cancer has spread. If maybe it's going to decide if it's going to do a surgery or if it's going to do a radiation. It depends on the type of cancer and how far it has spread. And then I'm going to be talking about a story. I've got a friend of mine who was also having problems with developing lumps in her breast. And she didn't understand what was that because she was not familiar with breast cancer or self-examination until she decided to go and consult to a doctor. And the doctor did some tests and found some lumps. But luckily, those lumps were not cancerous. They were just lumps that could be cured, and they were cured. And luckily, she was cleared. So, as you can see, it is very important for us to make sure that we do proper screening and we consult a doctor if we see that there are some lumps developing in our breast. Okay, thank you very much for listening. For more information to know about breast cancer, a month, you can visit www.cancerawarenessmonth.com. Thank you very much.